State University within the Western Transportation Institute. We've chatted before on previous webinars. Hopefully you've listened to those. And if not, today will be a bit of new information. It might look and feel a little bit like similar information that I presented before, with a couple of differences, which I'll point out along the way. So why don't we go to that first screen, which shows our agenda, or our next slide. What I'd like to do today is make you more familiar with our 7-step communication process. The reason I said some things might look familiar is that the 7-step process that we use particularly to create communication looks like our larger 7-step process within our positive culture framework that we use to collect data and pick the correct strategies or appropriate strategies, evaluate those strategies. It looks similar to that with a couple of differences specific to communication. So we'll talk about that process. We'll talk about the application of this 7-step process, particularly to problem gambling in Oregon. And we'll talk about your role, how you can contribute to that effort. You've already contributed in many ways, but how you can do so moving forward. And then some clear next steps that our team will be engaging in. So on the next slide is just a little reminder about who we are at the Center for Health and Safety Culture. Our purpose statement is that we are an interdisciplinary center. So we're a group of people that come from a variety of backgrounds. For example, my background is public health, and we serve communities and organizations through the research that we conduct, or that we conduct in partnership with other organizations or communities. And then we provide that research back out through training and through guidance, of particular guidance for either states or organizations or communities to cultivate healthy and safe cultures. So that's really the role that I play. I am lucky enough to take research and try to put that into practice at the local level, or translate that into concepts that folks like all the rest of us are actually working on at the ground level. So that's fun for me, and that's part of where my role comes in on this project, is that I get to then take a look at all the data that we'll be collecting in Oregon and then translate that back out for all of you to implement throughout the communities. So as we go to the next slide, I wanted to just orient us once again with our framework. The framework is the positive culture framework, and we've showed you this before on previous webinars. If you are not familiar with the framework here, on the next slide, I'll show you our website. Our website, if you're interested in learning more about the framework in its totality, you can listen to a previously recorded webinar just on this framework. On the next slide, it orients us with where we are in the framework. We are particularly talking about communication, so you can push the next slide, and I'll show an arrow here, particularly for communication. We have 3 critical skills that we believe need to be grown and nurtured throughout the implementation of this framework, and that is prevention leadership, because we are leading folks towards healthier and safer behaviors. Communication, which is what we're focusing in on today. There really isn't a prevention strategy that does not involve some sort of communication, so honing our communication skills is really important. And then integration is another skill that is more complex and really important, and that's the integration of a variety of prevention strategies to reduce harm. We know that there's no silver bullet, there's no one strategy that's going to prevent all problem gambling, but that it's a multitude of strategies done in concert with one another, and that's the work of integration. So to focus us back on communication today, let's talk about why we communicate. So on the next slide are a couple of different reasons that we communicate. We can list a ton of reasons of why we communicate, but 3 I wanted to draw to your attention are these on the slide. We communicate to close gaps, meaning we just don't communicate for the sake of communicating. We just don't throw something out there that we think people need to hear or that we want to say. We communicate to close gaps, meaning that we've learned, maybe through an assessment, through data collection, that people don't know something, that we need to boost knowledge, or maybe that folks don't have the skills to do something. So maybe we communicate to grow skills. Perhaps we communicate to clarify norms. Right? People have a misperception of what's going on in their community, and we know that that can create, or that can be a risk factor. So perhaps we communicate to clarify norms. Often we communicate to motivate other prevention strategies. So this can often happen with a communication campaign. Often folks will see a campaign message, maybe on a billboard, maybe on a poster, and then they start to ask, okay, what else are we doing in this community on X, Y, or Z? What other prevention strategies do we need? So sometimes it's just that motivator for additional prevention strategies. And ultimately, it's to be able to tell a new story in our communities. We're in charge of the story that we tell in our communities, and our communication, our skills are really important in how we tell that story. On the next slide is a 7-step process specifically for communication. So I will go through each of these 7 steps to describe what happens in each of the 7 steps, and then I will tell you about how we're specifically applying that step to this process or to this project in Oregon to reduce problem gambling. One thing I did want to notice that in the center of all of these steps is the social ecology, those levels of influence within our community. We know that individuals don't operate in isolation, right? Individuals' behaviors and attitudes and beliefs are shaped by their community around them, by their families, their peers, by the organizations that they belong to or the schools that they attend, and by the larger community's norms and policies and enforcement of those policies. So I orient you just to the center of that communication process just so that you see that when we apply each of these steps, we are thinking about them across those layers of influence in the community or across the social ecology. Before I jump into step 1, on the next slide, you'll see ways to apply these steps. I want to make it very clear that we are not focusing only on a communication campaign. When we developed this 7-step model, it was really to design any communication. Yes, creating a campaign is certainly one way to use the 7 steps, but we've also used the 7 steps in developing a presentation, writing a letter or an email, crafting an email to somebody, or even just having a conversation. Being prepared to communicate is also really important. It helps us make more effective communication. So the 7-step model, as we start to go through it, you'll start to see, oh, that's how I could collect information before I write a letter. So you'll start to see that. When you go to the next slide, I just wanted to point out a couple of things. Often folks think that communication campaign creation is relatively simple and it might address everything in their community that they need to solve. Unfortunately, that's not quite it. Communication campaigns are profoundly difficult and they're hard to make effective. So when they are combined with other prevention strategies, that's when we know that they are more effective. We need adequate audience exposure. That means that that message needs to be out there with enough dosage to be able to effectively change people's beliefs and then ultimately their behaviors. That's a lot of dosage of that message. And then we know that they need to be going on with other prevention strategies. On the next slide, I wanted to point out one other caveat about communication campaigns. Successful campaigns need to be grounded in good science. They need to be theory-based. So any communication campaign that our team puts out is very much developed from a theoretical behavior change model. We use the integrated behavior model. We often use the reasoned action approach, which you might have heard. But know that successful communication campaigns, because they are a strategy to change behavior, need to be grounded in good science. And also, they need to assess audience exposure and other process measures so that we know that we're being effective. On the next slide, we begin with step 1. So I just wanted to be sure that I pointed out those 2 things for campaigns before we got started. But again, let's focus us in and understanding that any of these steps can be applied, or these steps can be applied to any type of communication.
Hey, Katie, just to slide back a little bit, we had a question on how do you measure dosage?
Perfect. We're going to get into that. Absolutely.
Okay.
Yep, that is something that we need to talk about because that's one of, it's fairly simple to measure it, and it's incredibly important. So we will talk about that as I go on a little bit.
Great, thank you.
So planning is really important. We don't just want to throw out communications. We want to plan intensely for them. We want to know who are we communicating to? Who's our focus audience? And what do we want to say? Like, what is our issue that we want to talk about? So we're identifying those pieces. We're advocating to get access to that audience. So if we're seeking to meet with a team of people, how can I get access to that team of people that I need to communicate to? Often we need that audience, whether that's adults in my state or youth in my community, we need that audience for the collection of data so I can create my message, pilot testing my message when I'm ready, and ultimately evaluating to see if I have that dosage necessary. So we need to start to advocate and start relationship building with folks to get access to our focus audience. And then we need to plan to be sure that we have enough resources. Are we even capable of doing this well enough to see an impact? So on the next slide, you'll see that also in step one, we want to recruit stakeholders. This is where we really start to develop our team of people that's helping us plan this communication. Sometimes this is your coalition, sometimes these are your colleagues, but we're starting to recruit those stakeholders. Maybe it's a funder. Maybe you know that your funder needs to be attached to this campaign or this press release that you send out, whatever this form of communication is. They are an important stakeholder. We want to develop a timeline, right? This is the time where we say, well, if we want this communication to go out March 1st, let's back up a few steps and see what do we need to be doing now. Then we develop an evaluation plan. What do we want to know by the end of our work together? What do we want to know? What behavior do we want to see change, or what belief do we want to see change through this communication? And then we're evaluating at every piece along the way. We definitely want to start to evaluate dosage early, and I'll talk about that specifically in the evaluation section about how we can start to plan on that early on in our communication. We want to train our stakeholders and our key partners. We want to be sure that they understand what this communication is about and that they're able to correspond with people about this communication. You know, this makes sense in a large campaign. If you've got a coalition of people and you're going to put out a large campaign about problem gambling, you want to be sure that your colleagues and your coalition members understand what that campaign is about and are able to talk to it. Because the beauty of communication is that we need to continue to carry that communication through our conversation. So it's more than just a poster on the wall. It's more than just a billboard or an ad in the newspaper. It's the communication and the conversation between people that really takes that that billboard or that print piece to the next level and makes it meaningful within the community. So we want your stakeholders to be prepared to have that conversation. And on the next slide, we'll talk about what we've done in step one in this planning and advocating phase for this project. So if you recall, we had sort of a phase one of this project that took place in the a 6-month period, and then we started our longer term project together. So our planning was really conducted in the first 6 months. We identified all of you as key stakeholders in this piece and as members who could get access to the focus audience, which are community members, youth and adults. We started to identify who that audience specifically was, and again, I just said youth and adults in Oregon. And in step one, we also developed our logo and our branding. You'll remember this, that we went through the communication process actually just to develop this logo and brand for the future materials or communications that are going to come out. One of the nice things about developing a logo and a brand in relationship to measuring dosage is that you can ask people, have you seen a Reflect, Resource, Renew print piece or campaign ad or letter? And that sort of draws their attention to one particular form of communication, and that they can say, yes, I did hear or see that. And that's how we're measuring dosage, because all of the communication pieces that come out in the future are going to be tied together with this brand. So when we start to think about evaluation down the road, we want to be sure that people can easily identify our communication pieces, and they'll be strung together with this logo in front of you. On the next slide is a bit more about the application to this project particularly. So we also want to grow the capacity of our stakeholders, right? Give them the information that they'll need to do a lot of this work. And so we're having quarterly webinars. That's what you're on today. This is one form of building capacity. We'll all be together during a training, hopefully in 2019. This will likely be May. And then also, Roxanne and I have monthly phone calls together just to be sure that the project is moving on course, that we're meeting milestones, that it's really true to how all of you want this project and need this project to be. And then we did provide evaluation tips as part of that first contract so that you can successfully measure dosage in your communities. And also a timeline was developed. Sorry, I missed that one. So all of this work was done before we ever got into the data collection phase. Step 2 is about collecting that data. We wanted to be sure we had everything in place before we moved to step 2. And in step 2, and you can go to the next slide, step 2 really becomes the foundation for our work. We don't want to create any communication or make any statements that we haven't grounded in good data collection because we want to be accurate, right? So if you go to the next slide, this is a quote that I love because I think it's very true, particularly when we're doing social norms clarification. All truth passes through 3 stages. First, it's ridiculed. Second, it's violently opposed. And third, it's accepted as being self-evident. So when folks hear something that's contrary to what they assume to be true, they'll laugh and they'll say, oh, that's not right. That piece of information can't be right. It's not right about us in Oregon. Second, they'll oppose it. And they'll probably say something like, well, your data is incorrect because I know that not to be true. And then down the road, as they start to see these messages and these communications over time, they might say, you know what, that is who we are in Oregon. That is who we are. We're healthy. We have strong beliefs. We care about each other. So it's interesting to start to look at this quote being so true of much of our work, and knowing that you want to go into it standing on the most solid foundation of data that you can, so that you are correct when you make your statements. So as we move forward to the next slide, we absolutely want to collect this data before we ever create a message, because the data is what is going to create our message. So we want to measure, when we start to think about what do we want to collect, we want to measure actual and perceived norms, meaning that we want to know what people are actually doing, like how often are they gambling, how often are they playing, different types of games and things like that. That will measure their actual norm. Maybe it's how often did they intervene with a friend or family member. That would be an actual norm. A perceived norm is our guess. It's what we think most people would be doing. So how often do I think most people gamble? That would be a perceived norm. So we want to measure both of those. We want to see if there's a difference between the two, if there's a gap between the two. If there is, that can be a risk factor, and we want to clarify the actual norms. We want to measure injunctive and descriptive, and what that means is that we want to measure not only how often people are doing or not doing something, but we want to measure the injunctive, which is more like their attitude about it. So not only how often do you gamble, maybe do you think daily gambling is wrong? Do you think daily gambling is a risk? So we're asking more attitudinal questions that are really important for this work and really do help change beliefs and behavior. So we want to measure both of those. And then ultimately, communication awareness. This is our dosage. We want to measure how many times has somebody seen or heard this message, but also how many people have seen or heard that message. We don't want everybody just to hear it once or twice. We want them to see it over and over again because dosage is so necessary. And we'll talk about those numbers as we get to step 4. So that's measuring communication awareness. And I absolutely suggest that you measure communication awareness at baseline. So you could today go out and see how many people in your community, by doing intercept surveys, how many people have seen that logo that was created, that Reflect Resource Renew logo. They will likely say no, right? Because we have not released that to the general public yet. That's good. We want that to be our baseline measure. And then once messages are released or communications are put out there into the community, we want to see that jump. We want to see all of a sudden that they're starting to hear and see those communications. So we want to measure that communication awareness at baseline first. In relationship to this project, we have collected data so far, and we are going to continue to collect more. So a large assessment will be conducted, and it's being prepped right now, will be of Oregon adults' attitudes, beliefs, and behaviors related to problem gambling, and also intervening with a problem gambler. So also that intervening action, as well as their familiarity of resources available statewide. So we want to know how often are they gambling, whether or not they're intervening if they see a problem and if they can recognize the problem, and also if they are aware of the statewide resources. So we will be soon here after the start of the new year, we will be collecting this information through an online survey that our organization will be conducting across the state. So when the data is back, we will provide all the analysis and reports back that you guys all may see. And then on the next slide are a couple of other pieces to this data collection. If you recall, a handful of coordinators were randomly chosen to complete an interview, a qualitative assessment of your thoughts, your beliefs, your awareness of statewide resources, so that we can understand, are we shifting the beliefs and the knowledge of the key stakeholders, meaning all of you. So we did qualitative interviews with Kelly Green at our organization, not only for the coordinators, but also for some key staff at OHA. We also did, if you remember a while back, we did an assessment of communication tools. You guys completed online surveys, which provided us a wealth of information about how you want to see communications come out. What do you need? What are you already using that you feel is an effective way to communicate in your community? So that provided us a lot of information so that we know what methods you're already using and what you could use some more of. So we appreciate all of that feedback. Then it comes to developing the message. So now I've planned everything. I know what the topic area that I'm going to speak to. I've looked at my data. I've analyzed the data, and now I know sort of what I should be creating some messages on. So step 3 leaves us at message development. We want to take data that we've decided this is important to communicate because either people don't know that this resource is available, perhaps they don't know, they don't have skills in intervening with somebody who's got a problem behavior. Perhaps they don't know that gambling is a risk. Perhaps we need to share that piece of knowledge. So we're communicating with great intent here, and we look at the survey results, and then we develop our messages. So on the next slide, what I'm doing here is just showing you a handful of different ways to create a message. These are from different campaigns that we've done across the country. This first one is probably it may be familiar to you because it was done in your state, the Oregon More Project. This was a normative campaign. Not all campaigns are normative. This one was because we discovered a difference between the actual norm and the perceived norm of underage drinking. So this message is most Oregon students, 75%, believe it's wrong for someone their age to have nearly 1 or 2 drinks, or to have 1 or 2 drinks nearly every day. That's an injunctive norm, that believe it's wrong. That's very important because peer disapproval is something that is a belief that helps shift our behavior. So we want other students to know that most of their peers believe it's wrong for them to drink regularly. The next slide is an example. It's too small for you to see, but I am happy to send it out if anybody wants to see it. This is a seatbelt project that we're working on in 7 rural counties in Utah. And we use the 7-step process to develop speaking points for all of these county level coordinators. So we use, again, this quick 7-step process to develop the speaking point document. And then on the next slide, you'll see is a press release. So as we start to plan for press releases that we provide communities or that we send out ourselves, we go through the 7-step list in our head to be sure that we're communicating the accurate information, that we've grounded that in good science, etc. On the next slide, this is a checklist that we go through before we put out any information, before we put out any communication. You can go to the next slide. This checklist we call it the principles of effective media. They are 7 things that I always look for when communities are sending me their media or they're sending me their communication. I typically go through and look for these things. Is it positive? Is it framed in an appreciative way? Are we reflecting a positive behavior, or are we contradictory, meaning that we're discussing a positive behavior but we're showing a negative one maybe in the image? Is it normative? This is if you're doing social norms media. Not every communication is normative, but if it is supposed to be, then I check to see if they've got an accurate norm stated. Is it reflective? Meaning, does this piece of communication, is it reflective of our community? Is this how we talk? Does this look like us? Is it inclusive? Does it look like everybody's made to feel like they can be part of this, or are we excluding a particular group or shaming or stigmatizing a particular group? We absolutely want to be sure that we're never doing that. Is it neutral? Are we seen as a neutral source of information? Are we simply providing the information, or are we, again, sort of maybe making a moral judgment against that? And we absolutely do not want to do that. Is it clear? Can people read it? Can they understand it? We pilot test for this. And then is it data-based or source specific? Meaning that if we cited any information, have we put our source there? Because we want to be sure that we're always reflecting where we've received the information so that people can check in on that. Often they don't believe messages, and so we want to be sure that they've got the best information to check on these facts and figures. So as this applies to the project here in Oregon, we have what we will be doing after all the data is collected and analyzed, and you can go to the next slide, we will be developing tools for everyone to be using across the state. So we will develop a variety of tools to reduce problem gambling and to increase bystander engagement. What those tools are at this very moment, I don't quite know yet because we haven't seen the data, but we proposed to develop video pieces, radio pieces, print pieces, PowerPoints, speaking points, and press releases. Now, we also took in all of that information that all of you provided us with communication styles, what you seem to like to use in your county, what works well, what doesn't work. And we're taking all of that feedback in as well and modifying these pieces so that we're creating things that you will find useful. Again, everything will be branded with that Reflect, Resource, Renew brand and logo. And there is a style guide for using that, and we'll give you all the fonts and information that you need to use that logo. So this
So
is still
Katie,
yet to come. Yep.
so just quickly, one thing is, I looking at a question or a comment that it came in is that one, you guys are working on a project for us here at OHA that will be rolling out statewide, and so you are doing a lot of surveying of folks and evaluation, et cetera. But you also have been mentioning, the opportunity that they could also measure their own information. So for right now, the tools and everything that are being created for us are indeed Montana State University is doing the evaluation of all of these things. Once we roll out these tools to you at the community, then you'll have the opportunity to measure those as you move forward. So it's just a
Exactly.
point of clarification.
Yeah,
Yeah.
thank you for that, for asking that question, for making that point. Yes. Our goal is to give you the tools so that you can assess the dosage in your community of these messages. All right, so getting to that point right now is communication planning. This is step 4. Step 4, I almost like to do it before step 3. When you get to step 3 and you're developing your messages, you kind of want to run and you want to go forward in using those messages. So I tend to like to do kind of steps 3 and 4 together, meaning I'm planning thoughtfully how I'm going to release these messages, to who I'm going to reach, I'm going to deliver these messages, and in what form I'm going to deliver these messages, so that I know that I'm being effective. So as we know on the next slide, there are a variety of ways that we can communicate, and all of you gave us some really good feedback on that. So we're going to incorporate many different styles because people listen to different pieces of information, or they respect different types of information, or just use different styles of information more. So we're going to touch on a variety of ways to communicate when we are ready to get out these messages. But like I said before, and like people have been asking about, dosage is key. So if you go to the next slide, we know that you don't just have to ask your children once to pick up their backpack by the back door, or to put their shoes on, or to clean their room. We have to ask them many times over, right? And those are fairly simple tasks. We're asking people to change behavior, which could be very difficult. If somebody's problem gambling and we're trying to shift that behavior, or we're trying to shift behavior of bystanders to intervene more, these are very complex situations. So you can imagine that we need to say these messages over and over and over again before they start to believe them, before that starts to shift their behaviors. So what we're looking for is that we want to develop a communication plan that has a couple of, that helps us reach the dosage that we need. Typically, when we look at communications and we look at dosage, what I look for when I'm sort of analyzing somebody's survey results, when they've asked the question about campaign awareness, I look to see what the reach is, meaning how much of their focused population has seen or heard one of these messages. So the reach. This would be a percentage of your focused population. So if you have, just to make it very simple here, if we have 100 12th graders, and that's our focus audience, 100 12th graders, I want to know how many of that 100 saw or heard a message. Ideally, we'd have at least 80% responding that they have either seen or heard one of our messages. So we try to get our reach over 80%. But we don't just want them to hear it once, right? Again, these are complex behaviors that we're trying to grow. So that's where frequency comes in. So we want 80% of our population hearing or seeing a message at least every other week. 80% of our population hearing the message at least every other week. That doesn't mean that you have to put out a new message every other week, but that we want that message to be hitting them in multiple ways. So perhaps they're in the car and they've heard it on the radio, or maybe they heard it on a Pandora spot, or they've seen it on a poster at school, or perhaps it was read over announcements in homeroom. So they had 3 different or 4 different opportunities to hear or see that message in that week. So we want their frequency to be at least every other week that they're hearing or seeing a message. And then the duration is for how long? How long do we typically create communication plans? And typically we create them, our team creates them for a year. And then at the end of the year, we go back and we take notes. We're always taking notes on it. We're trying to build and grow our communication plan every year. But typically we see this lasting about 1 year. That doesn't mean that our work is over in 1 year. It does not mean that we've effectively changed everybody's behavior in that year, but that's how long our communication plan typically lasts. The next slide reveals something that I think is really important. If we now know that we want 80% of our population to be hearing or seeing this message at least every other week, you can click on the next slide, or click twice actually. We want to take a look at what our resources are. So in relationship to this picture here, if our job is to water this field and our resource is that watering can, what are we going to do? Are we going to put 1 drop of water on kind of the south end of the field, and then on the north end of the field we'll put another drop, and then maybe on the east side of the field we'll put 1 water drop? Or do we want to sort of put all of our water in one area and see 1 patch of grass grow? This is the whole notion of being a mile wide and an inch deep, and really looking at the resources that you have to do this work well. If you now know that you need your dosage to be very high in order to be effective, to effectively shift people's beliefs, and then ultimately their behavior follows, do we have the resources to go broad with the entire population? Or perhaps do we need to start a little smaller, see some success, see some movement, and then start to go more broadly after that? So one example might be, can I do this effectively? Can I put out all of these messages county-wide at one time? Or perhaps maybe do I need to start in one community, see how it works there, and then start to expand as I have the resources? So it's just something to keep in mind. And the watering can, the resource is not always money. It's often colleagues and coworkers and coalition members that help you do this. It's the time, it's the people, it's the technology, it's all of that that we consider to be resources. So to be able to keep this dosage alive and planned, we do a communication plan. So on the next slide, you'll see a very simple, clear communication plan. They can be incredibly simple. Some folks make them more complex just because it helps them understand how they're planning out their communication. As you can see in this particular document, what you would do is list the month in the first column. So maybe you have January, February, March, April, going all the way down, And then you might write in what events you're going to be at in January. If you're going to do a poster in January, maybe you're also going to do some verbal communication. Maybe in February is when you're going to put out the posters and different ads. So you start to populate this plan, sort of guessing how you're going to reach the dosage that you need to be effective. You might not have a good guess at what that takes. So I would, at the beginning, when I'm creating communication plans, I would start with as many free opportunities as you have available to you. You know, can people communicate the message during meetings, over the PA announcements? Can you get free ad space? So always sort of fill in your plan with multiple free options as well. As application to this particular project, we drafted a communication plan that all of you can use. We will certainly, and I've got a picture of that on the next slide, we will absolutely go back and update this once we know what the particular pieces of communication will look like. So as you can see, I had populated this with posters, a billboard, video ads, radio ads, web ads, and verbal communication. We didn't when I created this plan, we didn't yet have all of your assessment findings of how you wanted to communicate. So this was a draft that we will update as soon as we have those pieces in place. But know that you will get a sample plan that you are able to shift and edit for your own community.
I just want to add here, this is will be the communication plan that we will utilize for those communities that opt to utilize the resources and request additional funding from us. We know that that resources are part of moving this forward, and have listened to that feedback very clearly in the past. And so this will be the format we'll use, and you guys will then be able to populate this to then request the funding to implement whatever resources you're going to in your community.
Thanks, Roxanne. And I think that's really important. I think funders, we should always be looking to be effective rather than busy. Busy work would be just throwing up communications and seeing what sticks, right? It's like throwing spaghetti at the wall, seeing what sticks. Communication planning helps us be effective. It means that we are intentionally planning how we're going to communicate these things across the community so that we get the dosage we need in order to be effective. It is very simple to create an ineffective communication campaign. It's hard to do one well. So we want to set ourselves up to be most effective. If you go to the next slide, I just want to sort of kind of retrace our steps of where we've been in the past 4 steps. So we've gone over the planning. So we've gotten our team together. We figured out who our stakeholders are, who our focus audience is. We sort of figured out what the issue is we want to address. Maybe we've created a timeline and an evaluation plan. Then we've collected the data in step 2. In step 3, now we've analyzed the data and we start to create messages. Okay, what do our messages need to be based on what I found in the data? This is where we're helping out. Step 4 is, okay, now how am I going to get these messages out there? What are the best styles of communication to use and how many do I need to use? So we're planning that communication. Now we come to step 5, which is pilot testing. Pilot testing the information or the materials is critically important because we want your audience to get it. We want them to understand it. We want them to be attracted to it so that they'll actually read it. And we need to know if refinements need to be made. So on the next slide, it discusses why do we pilot test. So we pilot test for a variety of reasons. We want to be sure that the contextualization of the messages connect with the focus audience. Like, does this even make sense to them? Is it in the right context? Do they understand the message? Do they know the intent of the message? So we'll check in on each of those things. We will be pilot testing all of these pieces, but we can also give you samples if you want to pilot test locally as well. We can give you samples of how to do this work. I just showed on the next slide just an example of things that maybe were not pilot tested. Commas always being useful. On the next slide, this is in full disclosure. This is a piece that our team did years and years ago of an image that did not work. So this was for a college piece, a normative drinking campaign that was done, like I said, years and years ago. But when folks looked at this piece, when college kids looked at this in pilot testing, they just laugh and they're like, nobody will ever read that. We're like, well, why? Well, because nobody sits like that on the college campus. That doesn't look like us. That doesn't feel like us. So we were really wrong in that piece, and so that piece was edited. On the next slide, we'll talk about understanding. So we want to be sure that they're actually getting it. We have found that if you're using percentages, some people do not understand percentages. Often that's with a younger audience, but still, we want to be sure that they understand the messages. We can ask them, okay, in your own words, what does this say? Also, often with those statistics, if we are using them, we say, what does 7 out of 10 mean to you? Is that the same? Is it more or equal to 70%? So we start to check in. Do they really understand what we're saying? If they don't understand it, obviously it's meaningless to them, and we don't want that to happen. So we want to pilot test for that. Is it confusing to them? On the next slide, we realize that that is the most confusing language possible. Sadly, we have to be really clear. We have to be very close to what the question was on the survey before we create the message, right? So we have to stick real close to that survey question to articulate the message. And this one just did not work out for us. So most of us think big. 83% of Montana's young adults have 0 drinks or are not impaired, below 0.08 blood alcohol content at a typical social occasion. I mean, that's just a ridiculous message. You can't read it as you walk past. Even if you can read it, I'm not sure that you can make sense of it. So that's just an example of really confusing text. Don't do that. We refined that one. We want to see if they get the intent of this piece. Like, what does it really mean to you? Say it in your own words. Are we sending mixed messages? So on the next slide, this is something that I see a lot, is that we send accidentally some mixed messages. So this is where I often look at the photo or the image in the piece and does it relate back to the message. So if we're saying most college students drink responsibly, but we're seeing a sign that says binge drinking, and we're seeing maybe it looks like binge drinking in the picture, does that match up, or are we actually sending a mixed message? If we have a picture that says, most Oregon youth don't gamble, but we show a bunch of kids gambling, that is a mixed message. So we want to be sure that our messages and what visually we're saying on the piece are in correlation with one another. So who do we pilot test with? Well, we absolutely want to pilot test with our stakeholders. This is our stakeholders at the community level. This could be our coalition. This could be our colleagues. This could be our funders, local leaders, because we want to be sure that they understand it, that they get it, that they're ready to have a conversation about it should somebody come to them about it. Is it in any way contradictory to what they would say? Is it, sometimes we find this in schools, is it contrary to any of their policies that they have? We have run into this before with schools where perhaps we're showing a cell phone, or perhaps we're showing somebody in a tank top, and tank tops are against school policy, or cell phones are against school policy. So we want to be sure we're checking in on some of these things. And that's what our pilot testing with all of you will hopefully clear up. And then absolutely, we want to test with a focus audience. They're the most important folks. We want to be sure that they get it, that they understand it, that they know the intent of it, and that they're able to recite it, that it's clear enough to them that they can recite it back to you. For this particular project, we are pilot testing. We'll be pilot testing quite a bit. We've actually been starting to pilot test survey questions, because we also have to pilot test the survey, right? Can somebody adequately take the survey with true understanding of what those questions mean? We did pilot test the brand and the logo with stakeholders, with the general public across the state, and then with all of you. And then our media, any kind of communication that comes out will absolutely be tested with the stakeholders at OHA and all of you. So we will get all of those surveys to fill out for pilot testing to you when we are ready for that. Pilot test is incredibly important, and often one of the steps that people like to skip. We're doing this step for you, but we do ask that you please participate in it, because we do want your feedback. You know your communities best. Step 6 is implementation. This is a fun part. This is also sometimes a stressful part for communities when we actually go out with these communication pieces, whatever they may be. So on the next slide, we show kind of 3 areas that we really want to pay attention to. We want to prepare for that public response. As I mentioned in step one, we want to be sure that our stakeholders have talking points and that they know what to say. Did they know about this piece early on? Is their logo on it? So we want to be sure that they're prepared um, to discuss this piece. Are we prepared for how the public might react to this piece? Have we prepared ourselves with possible comments or calls that we might get? Are we listening to folks? Are we listening for a couple of things? One, are we listening for confusion? Are we listening for next generation messages, meaning that, wow, folks are really talking about bystanders. Maybe our next message that we go out with is about bystanders. Or perhaps they're talking about that they don't know what the 800 number is to call, or they don't know where treatment resources are. Okay, then maybe that's the next message that we go out with. So you're constantly listening to the community as they see your messages. And then lastly, and possibly most importantly, are you guiding those conversations? So are you just listening to folks question your message and walking away, or are you actually sitting there having a conversation with them? Because I really think that these messages can fall flat if you're not engaging in a good conversation about the pieces and what they mean. On the next slide, as we talk about the application to this project, you will all receive, we will provide it to the state, they will get it out to you, all of those pieces that I'm talking about in the form of a toolkit. So, like I said, we had predicted that we would give print, radio, video, PowerPoints, speaking points, press releases so that you can do all this work. We will again tailor those pieces to what you all said you wanted in the communication surveys. So we will provide all of that to you in the May 2019 training. So we are collecting data now, and then we'll be working to create all of these pieces within the year. And yes, and then we will be getting that out to all of you. So the last step is evaluation. And this is a piece that we've been talking about quite a bit because we want to know, are we effective? Are we getting out these messages appropriately, timely? Are we following our communication plan? Are they making sense to the community, etc.? So on the next slide, we'll see sort of different types of evaluation that we can conduct. The first is just process measures. Are we implementing the communication plan as we had intended? I often ask my communities that I work with, okay, let's go back to your communication plan. Let's talk about where we're at in the plan. They'll say, oh, I forgot that I'm supposed to be using that. Life gets in the way and you sort of put out messages as you can, but you're not following the specific plan that you had developed. So it's always a matter of going back to the communication plan, keeping that a live document in case you need to change the schedule at all. Because let's face it, things happen. Sometimes the school won't let you put up print pieces, or the billboard company was behind, or you couldn't play something on TV, whatever it might be. Your plan gets a little off and you just need to shift a little bit. Keep that a live plan and continue to stick to it so that we can measure those process measures. Intermediate variables, so these things that start to show up first in our evaluation that then lead to outcomes, are communication awareness. So are they starting to see and hear that message? If we can say within 6 months that they are not hearing and seeing our message with enough dosage, then we know we've got to boost our plan, right? So I always tell folks, after you've put out your first messages, wait about 6 months and then start to check in with the community. Are they seeing it? Are they hearing it? And if not, then we need to go back to the drawing board with our communication plan, boost our communications, and then go back out again. Are we seeing shifts in beliefs? This can be done maybe, annually with a survey. Are people thinking differently about problem gambling? Are they are they thinking that they should intervene? Do they think other people might intervene? Those are beliefs that we can start to assess. Do they feel that treatment is effective? And then lastly was outcome measures, and that's our behaviors and skills. These are the actions that we're ultimately trying to seek. Did problem gambling go down? Did intervening go up? Did increases in knowledge of helpline and of resources available go up? That would be our outcome evaluation. So as it applies to this project, we will be providing tips for evaluating the communication. So we will give you those questions about how to assess whether people are hearing or seeing those messages. And you can click on the next slide. Oops, I think I missed one. Oh no, here we go. Sorry about that. That is On the next slide. So these 3 questions are also really important. Sorry about that. This is good, the reflection part. One of the things that we always talk about too, but I think is often overlooked, is time for reflection. So that we are going through a process where we're asking ourselves and others, what was the most important thing that we learned as we implemented this communication plan? What would we do better next time? How has the conversation changed? So this is a really good thing for you and your colleagues and maybe your coalition if you have one to sit down and think about as you move forward through these steps. Because I would bet I would bet that you will find many things that you have learned as you implement communications. What you would do different next time, what you would do more of, what you would wipe out altogether, and make those notes on your communication plan so that you can, at the end of the year, reflect and see how things are going and change things up to be more effective the next time. When I say, how has the conversation changed? This is kind of a fun one to keep track of. You can do this by cutting out newspaper clippings, cutting out ads, even kind of keeping meeting minutes from meeting to meeting to see how are you guys talking about this issue and how is that evolving over time. So these are some of those different ways that you can measure how that conversation has changed. As it applies to this project, as I mentioned, we'll give you the tips. We'll actually give you those questions on how you evaluate communications. Are they being heard? Are they being said? We'll give you those specific questions and how you can get that distributed in your community. We will also be coming back and doing a second round of interviews, that qualitative assessment of the stakeholders at OHA and also of the random coordinators, so that we see, did those beliefs, attitudes, do those skills change awareness over the course of this project as well? So we want to follow up on that. The next slide, as we start to wrap up here, I just wanted to again say, yes, I've been talking a bit about a communication campaign, but also know that these 7 steps are very simple to apply in shorter, smaller communications. So presentations, letters, emails, conversations. We've planned town hall events. We've planned all sorts of things with these 7 steps. So know that it doesn't have to be some big, ginormous communication campaign. It can be very simple communication. And you could also have a small group. We've had a communication plan developed for one person who was the president of the university. So we developed that communication plan, and we all agreed to our part of the communication plan, and we effectively got a policy changed on campus. So keep that in mind as well. So your role, as we move forward, your role is, and has already been, those assessment interviews with our team. So those, I believe, are complete now, and we appreciate those that took place, that helped those take place. So we appreciate that feedback. And then Kelly will be getting back in touch with you to make sure that what she has recorded is accurate. So you're probably following up with her. We also would love your input in pilot testing of the media. Like I said, we will develop things and we will pass it on to you for your honest feedback. So we do appreciate that, and you can give that confidentially. We also want your role to be learning about the tools. So we will all come together face to face in a training where I can tell you about the tools and show you how to use the tools and what the tools are for. So we want you to pay attention and to learn and to ask questions about these tools, because if you're going to distribute them throughout your community, we want to be sure that you are the expert on how to use those. And then ultimately, yes, once you're the expert, getting that information out with enough dosage to be effective. So this is going to be a big step for you guys moving forward. That is all that I have today on the 7 steps, but I do want to bring your attention to our next webinar. So we're already planning ahead. Our next webinar will be on March 1st. So we will have that at 9 a.m. and that will be on the data collection process. So on step 2. We've kind of given you an overview of what all of these communication steps are, but one of the biggest steps is collecting that data. So we're going to specifically have a webinar on how that data collection is being done and where we're at in the process of that data collection. So we'll be doing that on March 1st. You can mark your calendars. And now I'll open it up. Roxanne, have any other questions come in?
Katie, I'm not seeing any questions we haven't addressed yet. We did have a request that you do send me the tips and PSA example, and I will include that when we send out the CEUs for the webinar. But at this time, I'm not seeing any questions that have come in. However, you can, if questions come up later, always feel free to send them to me, and I can work with Katie to make sure we get answers and get those out to you guys as well. So
Absolutely.
without any other questions, is there anything last minute you wanted to share, Katie?
No, that's everything for me. Thanks for being with us today.
Great. All right. Well, thank you, everyone. And so once again, this has been recorded. So those who weren't able to join us will be able to still participate, as well as if you want to come back and revisit this. This will be posted on the Oregon PGS website. And have a great day, and we'll talk to all of you soon. Take care.
Bye. Thanks, everyone.